for Hull University Teaching Hospitals. I'm here today to talk to you about medicines management. My job is medicines management in the Trust, so I'm responsible for making sure that everything educationally wise around medicines and sort of policy wise as well is proper, it's up to date, that things are going as they should be. So today we've come to talk to you about your expectations around Year 1 medicines management. So can I just have a quick show of hands? Who's adult nursing? Oh, that's a lot of you. Gosh. Okay, who's children's nursing? Oh, hi guys. Not so many of you. Have we got any midwives today? No. Have we got any mental health nurses? Have we got any paramedics? Oh, well done you lot. Brilliant. So I bet the paramedics are all sat there going, why am I here? Is that correct? Yeah, fantastic. So the reason that you guys are here is because you are going to do placements in clinical areas, and it's really important that you understand medicine and medicine safety in the same way. So I thank you for being here. We're really grateful that you're here today. I feel like I'm now doing a sermon, so I'm going to move on. So the exciting thing about this presentation is I only saw it on Friday, so we'll all learn together, shall we? I think is the thing around this. So what we're going to do today, we're going to look at what medicine management means and what it means to you. We've never done a session like this for this university students before, so I'm quite excited that we're starting to have these conversations so early on in your career, because it's really important. I want you to be able to recognise what your role is as a student, paramedic, nurse, or children's nurse in around medicines management. And I want you to be able to, at the end of this, discuss how to apply medicines management in your clinical area. So, quick question just before I move on: has anybody worked in a hospital before? So probably less than I imagined. So some of you will never have seen what a hospital ward looks like, what a treatment room looks like, and things like that. So hopefully we'll have a look at those sorts of things today as well. So, let's talk baseline. I want to know what you know about medicines management as a group. So it's really difficult. I could come around with my microphone, couldn't I, and point my finger at you and make you talk. But I suspect you'll all feel a bit sick if I do that. So what we're going to do is a Mentimeter. Is everyone else as excited by this as I am? I love it. So medicine management isn't just about giving medications. There's lots of other things that are involved in the safety of medicines. It is a system of process and behaviours that determines the way that medicines are used by patients. And we have a huge part to play in that as administrators and also prescribers sometimes, because some of you may go on to be prescribers as we go along. This next slide looks at all the different types of things that we expect that encompasses medicines management. So we've got the storage of medications, and we're going to look at the storage of medications, about how we store medicines. There are different types of medications that we use in the organisation and in hospitals itself. So there are some medicines that we lock in a cupboard, there are some medicines that we lock in a controlled drug cupboard. So there are different levels of storage of medications. The other thing that's involved in medications management is the safe disposal of medicines. So for those of you that maybe take medicines at home, there is a certain process that you have to go through around disposal of medicines if they're out of date or if they're not being used. So it's important that we dispose of them properly, things like sharps and things like controlled drugs, drugs that are very sellable, maybe on the street. We have to be very careful about the way that we dispose of those. There's obviously the administration of medicines, and for a large proportion of you in this room, that is going to be a big part of your day-to-day working life if you work in a clinical area that administer medications. Dispensing of medicines is similar, and that's kind of a pharmacy role. And there's also medication administration and record keeping, so that's going to be another large piece of work that you'll be involved in. So how do we inform all of these? Did the screen just go off? Yeah, okay. How do we inform all of these decisions that we make? So for those of you that have anybody had a clinical placement yet, or are we going into these first placements? So I've got one hand up here. Do you have access to the intranet? Yeah, so Who's North Bank, who's South? North Bank. Put your hands up. Are we all North Bank? So on this side of the water. Oh, it doesn't exist anymore, sorry. Forget that, I'm old school. So all of you could be having placements in Hull University Teaching Hospitals, or in fact another organisation, perhaps Scunthorpe or one of the Northern Links Trusts. But in Hull University Teaching Hospitals we have an intranet, and the intranet is called Patty. For those of you that live in Hull or about Hull and understand Hull things, she was called Patty after the potato cake. So that's the name of our intranet system, and that is our internal internet system. On the intranet we have lots of policies and procedures. One of the policies that you really need to familiarise yourself with as early as possible is the drug policy. It's around about 90 pages long, so it's a very, very big document, but it's really worthwhile at least seeing where it is and picking out the bits that you think might be important to you. So when you go into clinical practice, this is what dictates what we do. So policies and procedures. We also have something called standard operating procedures. Now SOPs are basically a step-by-step guide as to how to do a process. So if you are asked to do anything in clinical practice, it's worthwhile looking at the SOPs around the medicines, because it will teach you exactly how to do that in step-by-step. Oh, there we go, we've got the SOP up there. There's one of the SOPs around medical gases. So you'll also maybe look after medical gases when you're out there, so that's oxygen and things like that. And for those of you that are paramedics, you'll probably be using Entonox, which is a medical gas, so you do get involved with medicines in that respect as well. We also have things called the Lessons Shared document in our hospital. Now it's a monthly newsletter, the one on the right to you, and that quite often in there we have information around things that have gone wrong in our trust. So we're a really open and transparent organisation, and one of the important things that we do is learn by things that go wrong. So if we do have things that have happened in the trust, we'll share it, and it'll be on the Lessons Shared in a way that everybody can understand it. So it's worth looking out for that on the Patty pages as well. So now we're going on to the good stuff, the storage of medications. So what we've got here is a short video, just an introduction really into a clinical treatment room. Not all of our treatment rooms look the same across at Hull University Teaching Hospital. Primarily that's because we are two different trusts. We've got two different hospital sites, so we've got Castle Hill and Hull Royal. So there is a big variancy between both hospital sites. So Nisha here is one of our nurses, and she's going to just show you around the treatment room so that you can get a feel for what might be in it. It's worth having a good think and a good listen to this, because there might be a little test afterwards to see what you can kind of pick out. So make sure you pay attention. So she's going to go in through the treatment room door, which is a locked door that we use to keep our medicines safe.
All the trolleys, there are your doctors doing your bloods, your gauze, your tape, everything that you need is perfectly drawn here, and you've got your preparations next here. So we come into the dressing ones, so all your dressings are all over here, all label that you need for surgical, all your aseptic dressings, all your skin dressings, all your skin tabs and everything. And then we'll move on to the next trolley, which has got your fluids preparations for your drips down, your blood feeding sets, and then you've got your bandages for your surgical wound or any sort of wounds. Okay, so we'll move on to the next section, which is all your blood cannulation stuff, and still your beginning sets accessories here. And then you've got all your blood needles, like your cannulations, your different sort of sizes of cannulations in there. And you've got your analysis source in here as well. And you've got all your dressings, your catheter packs and stuff, all sterile stuff. Okay? So moving on to, you've got your sterile gloves here, and then all like your flushes extra that you need to top up. And then your clinical bins, and your pharmacist drawers, where you put all your return pharmacy medications. If the patient's discharged, or if there is any medication that's on the trolley that doesn't belong to the ward, you can put it back into the pharmacies and get them to then take. So I'm just going to show you how the medications should be kept in a cupboard, or should be locked with the key codes, or you can have padlocks on different wards. So let me get into the cupboard first. 1 second. So on this side of the trolleys, we've got all the oral medications, which goes from alphabetical orders, and then we've got your antibiotics, which are on this side, and then your painkillers on this side. And then we've got your medications for your bowels, and all the laxatives on here. And we've got your MRC treatment, your Cavalons, and all your creams, extras that you need for the patient. And then moving on to the next cupboard. Right, so this one is for your IV medications. So all in like alphabetical orders, which you need, your water for injections and your antibiotics. And these are all your anticoagulations, your fragment injections, and all your IV paracetamol. That's the benefit. Right, moving on to all your syringe medications, like where you draw your IV medications. So they're all in the drawers where you've got your 20ml syringes, your 10ml syringes that you need for your antibiotics. And you've got all your flushes down here, and also your water for injection, and some labels that you need to pop it in when you mix the medication. So always remember to fill this in when you're mixing the medications, which is added to a different dose. Okay? So when you get rid of all the sharp needles, so you've got your pen bin, which looks like this. You've got a small one as well, so you've got all like different sizes in the clinical areas. So you have to fill in your hospital, your ward areas, who you started with, and the date. And then when it finishes and when you close it, you have to add your initial as well and the date. So when you go past your clinical areas, that should always be halfway closed. It shouldn't be fully closed or fully opened, just to stop yourself from pricking your knee and there. And then always make sure you fill it up to there, and you need to have a tag when you finish closing it. So it's always usually a blue tag to close it and then dispose into the yellow bin. Okay? Right, moving on to this is all your preparations for your IV medications or your oral medications. And then moving on to your oxygens, where your oxygen cylinders are kept. Always make sure you can get it out. They're all full to the green line, and always make sure it gets changed when it comes to the red one. Always remove that label and make sure you turn. Once you've opened the seal, make sure you open the oxygen and the oxygen's flowing, and just double check it before you connect to the patient. And this is your oxygen cylinder recording. Okay. Right, moving on to your CDs, which is your CD cupboard. You should always have a lot.
That's a controlled drug cupboard if you're not sure.
Areas. So you need to check with 2 nurses when you're giving medications out. Okay, so it should all be locked and have the separate keys. So this is your insulin medications, where your insulins are kept. It should always be locked, and the temperature should always be within the range. And then you can always keep your 46 or your nutritional drinks as well in here, but it always should be kept, and the key should be with the CD trolleys. And moving on to where the fluids are kept, it's all labelled and all into different areas. Like, so you've got your 100 mils, then you've got 250s, then you've got your 500 or 1000 mils. But you always need to kind of rotate your IV fluids so it's within the date. If they're out of date, you need to ring the pharmacy, ask them to collect it. Right, that's it for your trip of the treatment room. Thank you very much.
I won't play that again. That was Nisha, one of our nurses. She did that for us just last week, so we haven't had a chance to edit it down. We'll do it slightly differently next time, I think. But hopefully that gives you a bit of an indication about what a treatment room looks like. So one of the key things was the door was locked on the way in. So one of the things you might see when you're out in clinical practice is a variety of things. You might see people prop that door open. You might see people put a towel over the top so it doesn't bang on a night shift. What do you think about that? Do you think that's a good practice or a bad practice? So good practice, put your hand up. Bad practice, put your hand up. Brilliant. So if you see things like that out in practice, that clinic room door needs to be shut. Does anybody want to be brave and tell me why? Put your hand up if you want to say it, because I can't hear. Yep. Excellent. If anything goes missing, you get crucified. So yeah, potentially. So it's about being secure and safe. So as registered and non-registered practitioners, we're responsible for all the medications. Anything else? Potentially. So somebody could help themselves to that wrong drug as well, couldn't they? Anybody else?
Fire hazard.
Wave your hand in the air if you're talking. I have no idea which way. Yeah. Fire risk, yeah, so they're fire doors usually as well, so absolutely. We do have a risk. Can you think of any elderly patients that might be at risk? Dementia patients, yeah, we get a lot of wandering patients, and the last thing we want is for our elderly dementia patients to wander into a drug room. There are some other patient types as well that we really wouldn't like to go in a drug room because they may help themselves to medication for other reasons. So we just need to be really careful about that. There was something else I saw in the video that I quite liked. Did anybody clock when Nisha was opening the keypad? What happened to the... Yeah. Why did that happen? So we don't see the code, yeah. So we don't share the code, and occasionally you'll come across codes being written on the door, which is really handy, but not safe. So it's things like that that we need to be really careful about. Hopefully, when you get into your treatment room, that's one of the first things that you just need to get to grips with. You'll need to find out what that treatment room door code is, so you can get in and out, and you'll need to make sure that things in there are safe. Some of the stuff that I really want you to take away today is making sure that medicines are safe in your environment when you're there. So if you see things out on the side that shouldn't be, it's about putting them away, locking them away, and making sure that they're safe. And that will help to embed this practice in you really early on, rather than picking up bad practice as you go along. Okay. Oh, I've given all the answers away. It's no good, is it? Hang on. But I think you're gonna ace this anyway, guys. So this is another treatment room. This is a different view of the treatment room. So these types of treatment rooms tend to be across our Hull Royal site. So they don't have as much room as our Castle Hill site. They're quite luxurious in comparison. So every single treatment room you come to when you go out and about will be different. So what I want is really just some ideas about what you think of this treatment room. If you want to shout out an answer, put your hand up so I can see where you are. But what do we think? What's right? What's wrong? Oh, I'll ask.
The doors are open, not locked.
Oh, you've given me two. Gosh, who wants to get the second one? No, so the treatment room, the doors are all open, aren't they? What else is open? Oh, okay, that's a good one. So we've got information governance, yeah. So you can see that you've got some drug cards and things out there and order books, and that's really important to make sure they're aware. Did you want to come in there, sir?
I said patient details are open.
Patient details, yeah. Anything else? At the back?
The liquid medicine, I think, should be in the fridge.
Liquid medicine.
It looks
Just
like it.
the pink one?
Yeah.
Well, that's an interesting one, actually. Does anybody know what the pink medicine is? Who said kiddie scrub? It's not. It's chlorhexidine, so it's a spray, a pink spray. It looks quite appetising though, doesn't it? It looks a bit like a cheeky voodoo or something that you might find back in the pub. So that's unfortunately what some of our patients think as well. So we need to make sure things like that are separately kept away. That is a topical solution, so we use it to clean skin. We have had an incident where an elderly patient drank it and was really poorly afterwards, so we need to be really careful. But you're right, whoever said the pink medicine, should be in a locked cupboard. I've got some hands up over here. Stripey top. Sharp bins are open. Oh, they are, aren't they? Very open. Now, what's the risk of a sharp bin being open? Put your hand up. needle stick injury. Have you been taught about needle stick injuries? Yeah, as part of your medicines management. So that's, sorry? Sharps, yeah. So sharp injuries, yeah. So when you might needle stick yourself if you resheath the needle, if you're giving an injection, and the risk is there that you end up being contaminated with somebody else's blood, and that's quite a high risk, particularly when you're cannulating and things like that. So we do need to be careful that hopefully you won't be poking your hands in the top there though, because it's not a sensible move. What else is interesting if the sharp's been left open? What else could happen? Potentially cross-contamination, that's a really good one, I hadn't thought of that. But what about if that drug, if that shark's fin falls off the side? What could happen? All of those needles could fall out, couldn't they? So if we had the temporary closure across the top, that would mean that that wouldn't happen. So that would be good. Do we have anything else that we think about this this interesting treatment room? Yeah, it is, isn't it? I'd feel really uncomfortable working in that environment. Have you all been taught about human factors? Have you heard the word human factors before? No? So human factors is something we talk about a lot in healthcare, and it's about the things that factor into why you make mistakes. So do you think that would be a good environment to be concentrating on a medication in? Doing a really complicated... it makes my fingers itch when I look at that, it's awful. Some of the other things to notice are, do you see that fridge up in the corner? Does that look safe? You see the fridge right up in the end near the pink spray? That's on wheels. So we don't want that wheeling off or wheeling on our heads or anything. So yeah, is there anything else that anybody's noticed, or are we done with that one? Oh.
The green trays have got labels on.
The green trays haven't got labels on. Some of them haven't, you're right. Not so bothered about those, but that's a really good thing. If they were IVs, so if they were intravenous fluids, we would be really worried about that, because when Nisha showed you the treatment room, all of those boxes were really clearly labelled to avoid mixing up, but they should be labelled. I think just from a Mrs. Hinch point of view, that would be a good thing, wouldn't it? We love a label, so it'd be good to have labels up in our treatment rooms. The other things are that you can see there's an order pad on the top next to those medicines. Can you see that kind of here? So that means somebody could just jolly along and help themselves and order whatever medications they want. So that should be locked away as well. So there's a lot of things there that we're not particularly happy with. So we've just got a few bits there, but I think you've managed to capture them all and more, so well done. So if you see a treatment room like that, and I come on the ward, I want you to come up and say, look, I've cleared it all, I've tidied it. I'll be really pleased if you start sort of taking notice of some of these things. It's really, really important. Okay, so what can we do to ensure that we are storing our medications safely? We've kind of had a really good chat, haven't we, already? We've seen a video to see about those things that might help us. But we've talked, haven't we? So we've got sharp bins are not overfilled and the temporary closure mechanisms in use. So Nisha said when you get to the 3/4 line on the sharp bin, that yellow bucket, that they should be closed and sealed and signed and gotten rid of. And they go into a big yellow clinical bin. So the ones that you've seen that sort of lift up overhead, have you seen those before? Big yellow bins, so they go in there. And then that bin should always be locked. The reason we lock that bin is because quite often sharp bins are very sellable, especially when you've got contents of things from a hospital. Can anybody imagine why that is? Put your hand up. What was it? Sorry. Organised crime, yeah. So when we did the vaccines, we did the vaccination clinic, the vaccine sharp bins were really popular. Can you imagine why? Because at the very beginning, people weren't getting vaccinations, so people were like trying to get hold of our sharp bins so that they could try and nab as much of the vaccine as they could. So it's really important that we're aware of things like that in practice. We've got the treatment room door to be locked at all times, and we've had a really good chat about that. One thing Nisha didn't show you was a drug trolley. So all of the clinical areas have got drug trolleys, and they're like mini lockable cupboards. So you keep your patient medicines in them and you trundle around and you give them out as you out and about. You must make sure that they're locked at all times, and it's really, really difficult. When you're giving a medicine, quite often, you want to start talking to your patient or whatever, and you'll turn your back, and you can't see what's going on behind you. Your patient only needs to fall out of bed and somebody could be into your drug trolley. So I think it's really important that you're aware that that is part of your responsibility as well. The other thing is, when you've finished with your drug trolley, it should be locked, and then we lock it to a wall. So there are these like big nuts on the side of the walls and bike chains that we we don't bike the trolleys to them, we lock the trolleys to the wall with. Now that's really important because if you don't do that, what tends to happen is, me as the matron, I'll walk on and run away with the trolley, just for a joke, just to see if people notice. And I also walk away with keys in my pocket as well. And do that quite often if you see it in a clinical area. And there is a small pit in your stomach that drops when you realise you haven't got your keys because you left them in a cupboard. So it's really important that we keep those things locked. What are you going to do then if you see all of these medicines that are out and about or not in the right place? What sort of things can you do? As a mere student, what can you do? Are you going to do anything? Medicines. Yeah, okay, so what sort of escalation can you go down? So what sort of things would you feel brave enough to do? Who said tell someone? Who are you going to tell? Some senior person, so one of the charge nurses, or maybe your mentor, your practice supervisor, somebody like that. Who else can you tell? If you're seeing the same thing over and over again, it's making you feel a bit uncomfortable. Who else can you tell? You can day-tix it, yeah, so you can put an incident form in if you want. But the other people are your PLF team and myself as well. My email is available to anybody, and I do take it seriously if you're seeing things. Because like I said, I can't be on every single ward at both sites. But you guys are out and you're like eyes and ears and you can really help to improve our safety out there. Okay, so let's see what's on the next slide. Aha. So this one is another Mentimeter. Come on, another Mentimeter. Okay. So, what I want you to think about is the role of the pharmacist. So what do pharmacists do? And let's put that on a Mentimeter. So there's the details. So we've got, and the scanning thing, pharmacist. So every ward will have a pharmacist available to it. And they're really, really useful. And if I can give you any advice, I'd suggest that you try and get like an hour with them or something. Maybe follow them around and see what they do in practice, because it's really quite interesting to see what they do, and they'll be able to really drill down in terms of giving you advice and things to look out for. But they support best prescribing practice, so they make sure that anything that is prescribed by the doctor is checked and double checked. They make sure that antibiotics are used correctly. Does anybody know about the antibiotics and how dangerous we are as the world, really, about antibiotics? Have you heard of antibiotic resistance? Yeah, that's exactly right. It says we're using them so much that they're going to stop working. And to the point where, quite frankly, if we carry on with the same sort of manner of prescribing and taking antibiotics, there's a good chance that a really simple infection could kill you. Babies will die, women in labour will die. There is so many different angles to it, from the misuse of antibiotics. I am going to ask that we have one conversation. It's quite distracting as a presenter, please. You can just be respectful. Thank you. So that's antimicrobial stewardship. You can sign up to be an antimicrobial steward as part of your studentship. And I would really recommend that you do it, because it's important that you understand where we are at as an antimicrobial trust as well. The pharmacists also develop policies and protocols around medication use, so they are a really good resource. There's also medicines management assistants, so they are the team that go around and do things like reconciliation. So when patients come in, they're the ones that make sure that the medications they've brought in are safe to use. Now, particularly you paramedics at the back, you'll be bringing in patients. I love how you all lifted your heads then. I can see you. But yeah, so paramedics, you'll be bringing in bags of medicine. I guarantee when you're bringing in patients, you'll have them that'll go, hang on a minute, and they'll bring a truckload in. And our medicines technicians will be checking those medicines to make sure they're safe. Because quite often we find that people that are on long-term medications will hoard and keep things that are out of date and stuff. So they're really good at making sure that these medications are safe to use. They also help with stock, make sure that we've got enough stock in our clinical areas and make sure that we can order what we need. So they're a great team as well. We also have medicines management assistants, and they're usually the ones that help put away medicines in our clinical areas and make sure that things aren't going out of date. That tends to be the types of things that they get up to. So we're moving on to one of my favourite subjects, and that's the cold chain. So when we looked around the treatment room, you saw a fridge in the treatment room. Was that something you expected to see, do you think? Yeah? Oh, that's great, because I'm not sure that everyone expects to see a fridge in a treatment room. Who said about the amoxicillin, the shaky amoxicillin? Yeah, so that is something that we tend to keep in a fridge. So we do tend to keep so many medications in a fridge. Now, as a student, one of your jobs is probably going to be to keep an eye on the fridge temperatures as you're there in placement. So we're just going to briefly go through the cold chain with you. So we've got another Mentimeter. Oh, thank you for sticking with me. We've got another Mentimeter. So this one is that code. Can you all get on with that code? Do you need the number? So this is a true or false. Okay, so cold chain is not important in medicines management. The cold chain is not important in medicines management. So shall I tell you a bit about the cold chain and what the cold chain is? Because I maybe did miss that bit out. So the cold chain is how the medicine has got to the fridge at the end point. So when a medicine is built or prepared initially, if it's a cold medicine, it needs to remain in a cold state all the way through until you give it. Those of you that may have been involved in things like insulin, we keep things like insulin in the fridge, and it's really important that it's kept at a certain temperature to make sure that the preparation remains stable and it's effective. So when we receive medicines from outside of the hospital, they usually are transferred in a hospital like cold chain bag, and they remain cold all the way through if they move from fridge to fridge. So I would say that for this one, it is false. So cold chain does play a massive role in medicines management to make sure that fridge items are kept cold all the way through. So is a fridge classed as a medication storage? So if you remember what I said about medicines trolleys, they're like portable medicine trolleys. So I don't know if you remember Nisha talking about the fridge when she showed you the video. Is it classed as a medication storage, yes or no? Okie dokie, so we're true on that one. So I like to call a fridge a locked cold cupboard. That's what it is. It's a medication cupboard. It's a cold medication cupboard. So whenever items are kept in a fridge, they should be locked. Quite often they're high value items as well in the fridge, so we do need to make sure that they're secure and safe. So this is another question. Does the temperature of the fridge, what should it be between? Should it be 0 to minus 15 degrees? No, 0 to 15.
Below or
We'll
degree.
soon find out, because I'm not sure about this one either, because I'm not sure how she's written it. Not degrees to 15 degrees.
Below between 0 degree.
Are we saying 0 degrees to 15 degrees?
degrees.
It looks like, doesn't it? So
Yes.
from 0 to 15 for fridge items.
Yeah. Yes.
Let's have a look. Oh, level pegging, this is getting exciting. And then it's a rubbish question. It's not written on.
From 0 to
It's not
15.
minus 15, it's 0 to 15. Okay, I'll put you out your misery there. So the fridge temperature should be between 2 to 8 degrees all the time. So 0 is a bit too cold, 15 is way too warm. So the fridge temperature should remain between those two numbers. It says the fridge should not be locked for easy access.
Yes. The fridge? No. Fridge should be locked. Medication should be locked.
So do we need to get in that fridge quickly, yes or no?
I have applied for the yeah. When did you normally pay?
I think I gave this away earlier. So what do we call a fridge?
You have to wait for them like for 2
A locked cold cupboard. So it should always be locked, no matter
But how
what.
did you pay?
They'll put it in your bank details. They'll send you an email to show you how to pay. Yeah.
Okay. So what should be kept in the fridge? We have a variety of different items that need to be kept in the fridge. You might see insulin, which we talked about before. We said about some antibiotics need to be kept in the fridge, but if we have got anything that's like a liquid, once it's been opened, that needs to be labelled. You might see creams such as steroids, and you might see some eye drops as well kept in the fridge. But it's really important that if they are for a patient, that they're patient single use only, and that they've got their name and the details written on there. One of the most important things is that we do not see food in the fridge. So believe it or not, we've had some areas that do store their sandwiches in our clinical medicine fridges. So if you do happen to see that, please flag that up fairly quickly because it's quite a significant breach of what we require. We can keep some food in there. So what food do you think we can keep in there? 46, yeah. So we can keep 46 and little things that are nutritional supplements, but we would never keep a cheese and onion sandwich in there. Okay, so this is a medicine bag. So when you are in your clinical area, you might see medicines delivered. Now our porters tend to deliver medicines. So they walk around with these green bags. They seem to do loops and loops of those. So if you see a green bag and it feels like it's got something in it, your responsibility as a student is to let the registered nurse know. If it is a fridge item, there will be a sticker on the front of the bag and it will say fridge item. And if it says fridge item, we need to get it in the fridge fairly quickly so that we can maintain that cold storage. Just going back to the fridge, you might be asked to do the fridge temperatures. Every day we check the fridge temperatures and we reset the fridge to make sure that the temperature is static. And it might be worthwhile when you go on your clinical placement, if you are on a ward that has a medicines fridge, that you have a chat with the housekeeper and ask them to show you how to do it. Because I put money on it. On a night shift, you'll be everyone will love you if you do the medicines fridge. There are certain checks that people, never get around to doing, and things like that will be really, really helpful for the staff. The other thing to know is that quite often people will stack these green bags on top of the fridge. What is the implication of stacking stuff on top of a fridge? Who said heat? Yeah. I once put goldfish on top of a fridge and that was a really bad idea. So don't put things on top of the fridge because it does make it much hotter than it should be. Okay, so you saw the green bin when Nisha was walking around the treatment room, and the green bin is that one on the left. Is it, as you see it? But the green bin, and that is a returns bin. It's a bit like a charity bin. When you drop something in and then it drops it down and you can't get your hand back in. They are locked to the wall, and we can put things like patient-owned drugs in there or anything that's gone out of date, and the pharmacist will come and clear that and get rid of it. So if you do see anything that you don't think fits anywhere else, have a chat with your mentor or your practice supervisor and see if you can pop it in the green bin. It's very exciting. A little job for you there. The things that cannot be put in the green bin are controlled drugs. So controlled drugs are things like your morphines, fentanyl patches and such like. So make sure that if you are asked to put any controlled drugs anywhere, they should always be taken by a pharmacist, or they should be destroyed on the ward by a registered nurse in a pharmacy. I think we're not far off being done here, guys, so I've got a couple more slides if you can bear with me. So what this says is that 237 million medication errors occur at some point in the process in England. So the process starts usually at the prescribing bit. So one of the things that's really important, and one of the things that we're focusing on as an organisation this year, is, well, not this year because there's not much left of it, is it? But in the coming year, one of the things that you're going to see little bits and pieces about is around interruptions in medications. So when prescribers are sat prescribing your medication, it's really important that they're protected, and likewise it's really important as a registered nurse or a student nurse when you're administering medications that you're protected during that time. I talked about human factors earlier, and that is one of the highest risk factors for giving the wrong medication to the wrong patient or the incorrect medication. So just bear that in mind and have a think about how you can protect yourself and other people during medication rounds. We talked about Sharps injuries briefly, but you should have been informed that if you do have a Sharps injury, it's important that you report it. We do need a day 6 for any Sharps injuries that occur in the trust. As a student, you're protected by the PLS team. They'll come and visit you if you do happen to have a Sharps injury, but we will want to know kind of what's led up to that and what training you've been given and what support you've been given. Bear in mind, you'll never be told off with it if anything happens. As long as you're honest and transparent about it, we'll make sure that we support you. What happens if you do have a Sharps injury, the first thing to do is bleed it, rinse it under a tap as much as you can, cover it up and then make sure that it's reported. You will need to also put it in the patient's notes to say that the incident has occurred, because we may need permission from the patient to sample blood from them if you do have a Sharps injury. But it's important that we give you the right support. We've got a really good team that will support if you do have a Sharps injury, but the best thing to do is try and avoid them really. Make sure that you're not resheathing the needles and that you're completely confident in what you're doing before you go in. Has anyone given an injection before? Got a few. Have you had a go at it yet? Yeah. Did you shake? No. Oh. Brave. I'd still do, I think. Okay, we've got something called Stop the Line in the organisation. Has anyone heard of Stop the Line?
Again.
Yeah? So Stop the Line is something that we do ask, or we do expect everybody to get involved in. Stop the Line is something that was started in a car factory many years ago, and it's about the process that anybody can get involved in stopping something before it starts. So they could press a big red button on a car production line if they thought there was anything going wrong. Anybody could say, stop the line, including, the cleaners or people in the back office. And we hold that same ideal in Hull University teaching hospitals. So if you do see anything that you feel looks wrong, even if it's just to ask people to stop for a minute and check things, it's really important that you put your hand up and say that and feel empowered to do so. Our chief exec's always said that if anybody stops the line, you'll never be in trouble for it, you'll always be congratulated. So it is something that we are pushing as a trust. We've talked about Datix and the reporting tool, so I won't go on with that anymore. And then we're on to the final quiz, and then we are out of here. So, well, I'm out of here and Alison will be looking after you. So, I'm going to hand over to Alison. joinmyquiz.com. Did you hear that? joinmyquiz.com. Enter join code 957520. You all need to log in to be able to do this. So had anything pleasant?
You are working at a general medicine.